Constructed in the 1950s, Nakaseke District Hospital serves patients from 6 districts in central Uganda. The pictures tell better the state of the hospital. The hospital has no ambulance. When they have patients in critical condition that need to be referred to Mulago Hospital, they have to borrow.
Our referral system is incomplete. Yet, as I've told you, we are this hospital. We get patients from the surrounding research centers, 3, 4, and we refer patients to the national hospital. So without an ambulance, as we are working now, it is very difficult for us to deliver the services.
Electricity supply is the other outstanding disabler. The hospital's meager resources do not allow for the authorities to use a generator to support 24 hours of lighting.
Most of the time, there's no power in Nakaseke. And when there's no power, to me there's no water, no services at night.
Dr. David Mubezi, the in-charge of Nakaseke Hospital, shares an experience with us.
One time, I was on table operating. The generator, there was no power, the generator went off, and we had to complete the operation using torches. However, when the situation is serious, that cannot even afford the fuel at times, what we do is to refer patients.
A walk through the general ward shows that the hospital is not big enough to contain all those in need of its services. There are few mattresses, and the few that are there have no beddings. At night or even on a cold day, the patients get a real taste of the cold and mosquitoes.
We got a supply of mattresses. These were about 42. But when you consider the number of beds that we have, this is just too small. And the old mattresses that we have are not covered. We have old mattresses not covered with rubber sheeting. So these are very difficult to use, especially in labor suit.
To make an already bad situation even worse, the doctors and other health workers here have gone 8 months with no pay.
We have a number of staffs who have not accessed their salaries right from September last year.
Mitiana Hospital is our next destination. There is no accommodation for the staff at the hospital, and so most of them arrive late on a daily.
Someone can hire a house far distant from the hospital. We tend to have cases of late coming. We have to get cases of absenteeism because they have to meet the daily transport, which is really not practical. So you find because of those gaps, your service delivery may not be on as expected.
The hospital receives 300 inpatients and 250 outpatients on a daily basis. But this hospital should not be written off. Same for Nakaseke Hospital. Armed with a $130 million loan from the World Bank, the government has kicked off a renovation and expansion exercise.
We have a comprehensive plan to renovate health facilities across the country, and we have allocated quite some money for this renovation, and these include 1 regional referral hospital, which is Moroto Regional Referral Hospital, and 8 general hospitals. These are the district hospitals. In Kiliandongo, we identified Kiliandongo General Hospital.